Okay, I'm here with Destiny. She's a new employee at Allure, and she's a laser technician, and we're gonna go over how you assess somebody for their skin type, Fitzpatrick skin type. So Dr. Fitzpatrick was a Californian doctor who was really a pioneer in lasers. He unfortunately passed away a few years ago, and he realized that the skin type is the most important determinant of the energy settings or the speed at which you fire the laser, and whether or not you'd have complications. Okay, so we're gonna go over like what we're gonna do for patients. We have a sheet here. This is actually from the Australian government, but this is basically based on Dr. Fitzpatrick's his lectures and his studies. So I'm gonna have the patient, we'll normally give the patient this form and they'll circle 0, 1, 2, 3, 4 of every one of these questions. So I'm gonna just do it for you.
Okay.
And number one, what are the color of your eyes?
Brown.
Brown. Dark brown or regular brown?
Dark brown.
So she's a 3, dark brown. Can you get in a little closer? Okay, you'd be staying close. What is the color of your hair naturally before aging?
Dark brown.
Dark brown. And what is the color of your skin in unexposed areas?
Oh, very pale.
Very pale. And do you have freckles on unexposed areas?
Yes.
Few, several, or many?
Several.
So here she's a 3, 3, 6, 7, 8. She's an 8. Okay. What happens to you what happens to your skin if you stay in the sun for an extended period? There's everywhere from severe burns to no burns and in between.
I burn first and then I get tan.
Okay, so we're gonna say moderate burn sometimes followed by peeling. Is it closest?
Oh, yeah.
And do you turn brown after sun exposure?
Sometimes.
And how brown do you get?
Like a light tan.
And is your face sensitive to the sun?
Very.
So here we have 2, 4, 5. Have you tanned in the past week, days, months?
No.
0. So we've got a 13. So we flip it over and we find 13 right here is white. Now, by definition, she's a skin type 2. But Dr. Fitzpatrick was wise enough to say there's an odd thing that occurs that's based on ethnicity. So I had a doctor I worked with her mother was white, Caucasian, her father was African American, and she had a light skin. But if somebody has genetics of a darker skin type, you tend to want to bump them up just a little bit for safety. They would tend to respond a little bit more towards your ethnicity when they don't line up, because we know you're Chaldean,
Yeah.
which is basically a Mediterranean area. They tend to be 3s and 4s, and you're defining as a 2. But look how close you're 13. If you're a 14 now, you're a 3. So 14 would be darker Caucasians, some Asians, and even like Mediterranean, Middle Eastern Caucasians and Southern. You're not anywhere near that. So we're gonna put you at a 3. So I'm gonna call you a 3, even though you might mark out to a 2. And that's when I want you to change it. You're looking at both sides. And somebody answers these questions and they're a 13, but in reality they're closer to here or closer to here. I'm gonna just bump it up because we're gonna base this on safety. We're gonna turn the energy down. And again, we have chances to see the patient again. We can always increase the energy, but we're not gonna change the skin type after it's been defined. And the provider's gonna sign off on this that they agree after that. So we're gonna call her a 3, okay?
Cool.
My genetics are, I did one of these, the Ancestry and 23andMe, and it's Finnish and German. I'm darker than you.
Yeah,
right?
way darker.
And it's like, just so you don't know. So I would actually, even though if I might genetically be one of these lighter colors, I'm actually gonna fall with my numbers be a higher number because I don't burn and stuff like that, okay? So that's the skin type, and we're gonna do that for patients, and we're gonna take a picture of both sides of the sheet, just like you do the treatment sheet for the medical record. Thank you.